Hello and welcome to this crash course on the introduction to electrodiagnostic imaging. Over the course of this video, we'll be going over some of the key concepts of electrodiagnostic imaging and discuss its benefits, risks, and much more. So with that out of the way, let's begin. Electrodiagnostic medicine, or EDX for short, is a medical subspecialty that focuses on diagnosing and treating disorders affecting the muscles and nerves. To simplify things for you, here are the three basic things that EDX is used for, namely diagnosis, evaluation, and treatment. Of course, these aren't the only reasons as to why we use EDX in the clinic, but these are just the easiest to remember.
Let's talk about electrodiagnostic studies. This encompasses a lot of different tests. These include EMG or electromyography, which records the electrical activity of muscles when they contract either at rest or during activity. Next is the NCS or nerve conduction studies. It measures how quickly electrical signals travel along the nerves. Next, let's talk about recording electrodes. These are the different electrode terms used in electrodiagnostic studies. So, first, we have the surface electrodes. It's used for routine nerve conduction studies, and they are either ring or disc electrodes and are either disposable or non disposable. Next is the needle electrodes, which are generally reserved for electromyography. It is also occasionally used in nerve conduction studies and is disposable and one time use only. They are classified as monopolar, bipolar, or concentric. So, what do these studies hope to achieve? These studies hope to determine if there are problems along the peripheral nervous systems or muscles and where exactly the problem is located.
Hi, I'm Peter Vincent Lim and I'm going to discuss about nerve conduction studies or NCS. Nerve conduction studies or NCS for short aims to determine the speed and quality of the nerve responses. This is done by placing electrodes on the skin. Electrodes are placed over a muscle innervated by the nerve meant for the testing. Example, placing electrodes over the biceps to test the musculocutaneous nerve. Nerve stimulation through electrical impulses. Electrical response of muscle is recorded and determines how fast and how well the nerve responded. The electrodiagnostic process. First is evaluate the patient through subjective histories and physical exams to develop a differential diagnosis. Then select the appropriate electrodiagnostic test to rule in or out the diagnosis. Then explain to the patient what the test will feel like and why it's being done. Then perform the study, usually starting with NCS then proceeding with EMG. Then interpret results in order to arrive at the correct diagnosis. Narrow the list of diagnoses. Then lastly, communicate test results to the referring physician. Two categories of NCS. First is motor nerve conduction testing. It is to test the nerve that carries signals to the muscles and other effector organs. And the second is sensory nerve conduction testing. It tests the nerve that carries signals to the sensory receptors.
Diseases or health problems that may be checked with the NCS. The Guillain-Barré syndrome, a condition in which the body's immune system attacks parts of the PNS. Carpal tunnel syndrome, a condition where the median nerve is compressed at the level of the wrist. The Charcot-Marie tooth disease, an inherited neurological condition that affects both the motor and sensory nerves. The herniated disc disease occurs when the fibrous cartilage that surrounds the vertebral disc breaks down. Nerve damage neuropathy can occur from issues such as diabetes, chemotherapy, and alcoholism. Sciatic nerve problems. Most common problem is the bulging or ruptured spinal disc that crosses the roots of the sciatic nerve. Notes for NCS. NCS can be performed on any accessible nerve, including peripheral and cranial nerves. Findings are generalized as how fast was the impulse traveling or how well is the impulse conduction. What does the electrical representation of the nerve stimulus look like on the screen? Like its action potential morphology, shape, height may suggest injury to some portion of the nerve like the axons or the myelin sheaths. Technical aspects of the NCS. Stimulators consist of two electrodes. We have a cathode and an anode. Site of stimulation, the more superficial the nerve, the easier and more accurate the stimulation becomes. Recording electrodes has three electrodes are used to record each potentials in the NCS and EMG. We have the active recording electrode, which is placed over the muscle belly. Reference electrode, sometimes called the E2 or G2, placed on the nearby tendon or bone away from the muscle. Ground electrode. Grounding is important to reduce artifacts. Grounding is larger than the recording electrode and has a large surface area.
So here we are going to discuss electromyography or EMG.
Electromyography, or EMG for short, is the recording of a muscle electrical activity by the placement of needles in the muscle. Examiner puts a needle into a particular muscle to study electrical activity. Electricity will come from the muscle itself. What data is received? It receives direct, which is the info about the muscle, and indirect, which is the info about the nerve of the tested muscle. Types of needle electrodes. First is the monopolar needle, which is made of stainless steel and have a fine point insulated except at the distal 0.2 to 0.4 mm segment. Second is the standard or concentric needle, which is stainless steel cannula with a wire in the center of the shaft. Third, bipolar concentric needle. The cannula of this needle contains two fine stainless or platinum wires. The fourth is single fiber needle, which may contain two or more wires exposed along the shaft. Indications for electrodiagnostic testing. Indications are paresthesia or tingling, numbness, pain, weakness, limp, myogenic or neurogenic atrophy, depressed deep tendon reflex, and fatigue.
We're going to be talking about the indications for electromyography or EMG. So first would be upper motor neuron lesions, lower motor neuron lesions, anterior horn cell disorders, radiculopathies, plexopathies, moneuropathies, and neuromuscular junction disorders, and lastly, the myopathic conditions. So in summary, electrodiagnostic studies are meant to first establish correct diagnosis or narrow the differential diagnosis, and second would be localized lesion. Third would be determine treatment if the diagnosis is already known, and fourth would be provide information on the prognosis.
So here are the skills to becoming a compassionate electrodiagnostician. So first, avoid keeping the patient waiting as it increases anxiety. Always explain what you'll do before you do it. Be clear that electrical stimulation only happens with NCS and not EMG. Explain that these tests will help determine the diagnosis. Reassure that you will stop the test at any point that the patient requests to do so. Start with the greatest area of interest and assume that the patient can't tolerate the entire study. Analgesics or sedative medications may be used for pediatric patients. Distract the patient during the exam to shift focus away from potentially painful stimuli. Distractions like making conversations or listening to music and etc. It is best not to show the needle due to its large diameter, as well as be mindful that ES sounds less painful than electrical shock. Assure the patient the exam will finish quickly. And lastly, keep the room warm because the patient is prone wearing a gown. For patient comfort, cold
temp can affect data to a certain extent. And that's it. Those are the skills you need to becoming a compassionate electrodiagnostician.
Key differences between EMG and NCS. EMG measures electrical activity of muscles. It focuses on muscles and how they respond to nerve signals, and needle electrodes are inserted into the muscle. NCS, however, measures speed and amplitude of electrical signals, focuses on the nerves and how they conduct signals, and the electrodes are placed over the muscle. Similarities between EMG and NCS. EMG and NCS, these techniques are used to diagnose and treat neuromuscular disorders. Both tests record electrical activity and are often performed in conjunction. For the clinical significance of EMG and NCS, both EMG and NCS are valuable tools in diagnosing peripheral nerve and neuromuscular disorders. To say that one is better than the other would be unfair, as both techniques have their intended purposes and both yield accurate results. What matters is the discretion of the therapist and the specific needs of their patient.
Now we move on to the special precautions. First is morbid obesity. It is impossible to localize specific muscles due to excessive adipose tissue, or fat tissue to be exact. Next is thin individuals. It is very easy to insert the needle too far and damage other tissues. This is mostly a problem for EMG, since EMG is the one that uses needle electrodes. Third is bleeding disorders. Patients with bleeding disorders and or on anticoagulation therapy should be assessed on an individual basis of risk versus benefits. So examples of bleeding disorders can be hemophilia, to name one. Lastly, blood precautions. Always wear gloves when handling the needle. Needle should be sterile and disposable, and always dispose needles in the appropriate container. Next up is the contraindications. For EMG, patients with severe bleeding disorders like hemophilia, thrombocytopenia, and other similar disorders are contraindicated, as are patients who have uncontrolled anticoagulative therapy. For NCS, patients who are positive for automatic implanted cardiac defibrillators or with pacemakers or with active skin or soft tissue infection are contraindicated. Lastly, we have the complications. We have infection, bleeding, and accidental penetration of needle into structures other than intended muscle. So these complications are more specific to EMG, as EMG handles needle electrodes. So that's why it's always important to remember what we discussed earlier about the special precautions and the risks and contraindications for EMG specifically. And that concludes our crash course for today. Thank you so much for listening, and we hope you learned something.